Good morning, everyone. I'm Terrence Wall. Welcome to the Monmouth Regional Chamber of Commerce, Chambercast. Proud to be here in Bellworks. This program is brought to you by the Monmouth Regional Chamber of Commerce. And today's event sponsor, thank you so much for being here, is Genesis Orthopedic and Spine. They have 5 locations. Yes, welcome. They also have a convenient location right nearby Route 35 in Middletown. I'd like to thank Bellworks, Ralph Zucker, of course, the visionary behind Bellworks, and the whole team here at Inspired Somerset Development. Today, we're bringing everyone home. This is about in-home care, in-home technologies, and cutting edge, first of all, the one-on-one, which is critical today, and cutting-edge technology and how it dovetails together on critical issues. You're hearing information that you have never heard before, and you're going to be hearing about it every single month moving forward in national media, in the in-home business, and how these technologies dovetail together on critical issues for everybody here, everybody in our world, really. We're going to go around the room in a moment, but it is, again, National In-Home Care Month, as well as National Alzheimer's Awareness Month. So we're going to go around the room, and we'll start with Genesis Orthopedic and Spine. Welcome, welcome, welcome.
Hi, I'm Kathleen. I'm the marketing specialist for Genesis Orthopedic and Spine. Thank you guys so much for having us today as your sponsor. Discover Genesis Orthopedic and Spine, your trusted experts in orthopedic and spine care, conveniently located in Middletown, New Jersey, and serving all of New Jersey. Whether you're managing orthopedic or sports injuries, neck or back pain, or recovering from a concussion, our team of specialists is here to help you get back to doing what you love. We offer advanced treatments, including cutting-edge, minimally invasive treatments, regenerative therapies designed to promote healing and mobility. At Genesis, we're committed to providing comprehensive, compassionate care tailored to your individual needs. Visit gsamedicine.com today to learn more about how we can help support your health and well-being. That's gsamedicine.com, Genesis Orthopedic and Spine. Thank you.
Thank you very much. Appreciate that. Before we continue, I also want to introduce our 2 guests that are here. Owner of Home Helpers Freehold, Howard Stein, will share his entrepreneurial success in owning and operating a successful, burgeoning in-home care healthcare business. Want to congratulate Howard on expanding the business, adding a second Home Helpers franchise in 2024. Congratulations.
Thanks so much, Terrence.
You're welcome. And among other topics, we're going to provide experience advice on the importance of individualized care for every client, emphasizing the importance of building industry partnerships, and I think there are going to be some partnerships that leave the building today from the conversations we're having, and to providing the highest care possible. Donald Parker, licensed clinical social worker, LCSW. These folks, by the way, when I was talking to Don yesterday, we were chatting a little bit because sometimes I'm trying to connect to make sure, like, what are the key messages? Because these meetings are designed to give useful, important information for you, your family, your friends that you can then share. And by the way, let folks know you're here today. Tag it on social media because this is information you're going to want to send to folks that you care about. He's a former president of Behavioral Healthcare Transformation Services for the Hackensack Meridian Network and the former CEO of Carrier Clinic. These are social entrepreneurs, is that what we're talking about, really, in the business of home care and issues that matter in the healthcare business. He's collaborating with university hospital systems around breakthrough recovery therapies, medications and surgeries, and technologies to improve healthcare issues such as Alzheimer's, Parkinson's, and substance use disorders, which we're going to be talking about today. Fascinating news. He'll also talk about new strategies to overcome the challenges of in-home care, as well as Howard will as well. So I'm looking forward to kicking that off, and let's continue with our introductions. Thank you.
Hi, hello, Aloisi, your independent insurance advisor. I'm on the board of the chamber as well, and independent means that I find the best rates for you, for your life insurance, health insurance, annuities, etc. Okay, Aloisi.
Thank you, Al. Hi, good morning. Gail Bonus. I'm the Administrative Specialist with the Monmouth Regional Chamber of Commerce.
Good morning, everybody. Thank you so much for coming. My name is Therese Rolke. I'm the Executive Director of this amazing chamber. We appreciate everybody, and thank you to our panel. I'm looking forward to hearing what you have to share.
Hi, my name is Teresa Marsh. I'm the Marketing Assistant at CSAV Systems in Colts Neck.
Hi, good morning. I'm Ann Mohammadi, independent corporate strategy consultant, and I serve on a couple of local charity boards, Lunch Break and Monmouth Park Charity Fund.
Good morning. My name is Kara Badger. I'm a financial planner with Northeast Financial Network here in Bellworks.
Good morning. My name is Irene Kesselman, and I'm the owner of Irene Kesselman Photography here in Homedale. Thank you.
Good morning, I'm Cherie Garrison. I own hands-on CPR training. I travel the state and I do CPR training for all different levels. I also have a site in Toms River, New Jersey on Hooper Avenue.
Thank you.
Good morning, my name is Michael Compton. I'm the Assisted Living Director at Homedale Brightview, and I'm looking forward to connecting with all of you.
Good morning. My name is Max Silberman, and I'm a part of the internship program at Homedale High School.
Good morning. My name is Elliot Cohen. I'm a business education teacher and internship coordinator at Homedale High School.
Hi, I'm Megan Flannery. I'm also a part of this program, and I am an intern at Data Pros here in Bellworks.
Hi, I'm Kate McGill. I'm also an intern at the bar. I'm an intern at the Bar Method in Homedale and a senior at Homedale High School.
Good morning, Jared Logan, owner of Go for Hire, career services and staffing, helping local businesses build their teams and get good people to work.
Hi, I'm Rahab. I'm with Home Care, Shore Home Care Services.
Hi, I'm Bridget Irvin with Senior Care Authority. I work with families to help seniors in transitional moments, and I specialize in placement.
Hi, I'm Chris Pellegrini. I'm a financial planner and advisor with Prudential, and we work out of Freehold.
Good morning, I'm Mark Vigiani. I'm a senior real estate specialist. I represent Keller Williams. I'm also on the board for the Senior Citizens Activity Network.
Good morning, everyone. Joe Marone, local mortgage broker Go Rascal, located right in Red Bank, New Jersey.
Good morning, everyone. I'm Tara Demianovich, Community Relations Director for the nonprofit Community Affairs and Resource Center. Thank you.
As I'm walking to the front, I'm Jeannie Wall, Jean Wall Media, publishing for Tap Into in Monmouth County.
Thank you, Jeannie. I'm Marco Albrecht. I'm an executive producer, video, TV, and film, and also a creative consultant and strategist. Thanks, Terrence, and the panel for being here this morning.
And you also work with helping people with substance use disorders. Thank you.
Yes. Thank you very much for that. I'd like a round of applause for the next generation in the back that are here today from Homedale High School. And the education community is critical because that's why we're here. We're here to educate folks. And Ming Chen, Shared Universe Podcast, he is the best. That's what he does. You know, so what I wanted to just really open it, first of all, thank you so much, both of you, for being here. Really appreciate it. In-home care, for folks, it's maybe a bit of a vague term. They haven't experienced it personally, and the continuum of care, the continuum of services from perhaps an inpatient side to going home, or perhaps being home in the first place. Can we start off with the definition for either of you to share? In-home care, what does it mean, and what are the challenges that industry is facing today?
In-home care, to me, means exactly what it says, and that is providing services in a person's house where they're familiar. There's a lot of benefits to that. When you can see a person in their own environment, taking care of them in their own home is the best place for most people to be. And it doesn't matter if it's personal care, like what I provide, the services that I provide, or if it's PTOT, whatever services, healthcare services that can be provided in that home, those specialty services are actually enabled to really maximize the outcomes for those patients. And I think we find that we get the best results when we're actually able to work with people in an environment in which they're comfortable with.
And the Home Helpers franchise that you run and that you own, how does that tie into the market as you see it now? Is there a burgeoning demand, a lack of hospital beds, depending on the type of care that's required?
Well, I think for me, it's all about senior care and veteran care, and we know that the senior population is really exploding. So there is a high demand. The challenge that we face, though, as an industry is a shortage of healthcare workers, and that's something that we really have to continue to focus on and ensure, especially in a community like this where there is resources, that we have the people to provide the services that are actually required.
Thank you for that. Don?
Well, my background in healthcare had me working in hospitals the early part of my career. And then I realized the power of the home as I was beginning to look at what are the roots of the issues that we're dealing with in a hospital. I'm a social worker, and my background around addiction got me fascinated about the roots of addiction. They happen in your home, in your neighborhood, in your connections. It is a network that gets you to the point where you need treatment. And so we need that network working the other side. They've got to be part of treatment. They've got to help us understand what got you to that point. And what a better place to do it than in the home. And today's technology and science capabilities are amazing. And to bring them into your home is even more amazing. So that's the business that I'm in now. I'm retired on my encore career from healthcare, 50 years in healthcare, and now I'm running a business called Recovery at Home.
And we're going to be talking about that in a little bit as well. You know, earlier, I don't know how many folks have an Oura Ring, or they're thinking about getting an Oura Ring, but the part of the tech, and I know you have a background in IT as well, with Aetna, part of the technology of today, how does that impact home healthcare? How does it facilitate the ability to monitor electronically, for example, in your field, Don, where you're working?
Yeah, I actually started using technology during my term at Carrier Clinic. About almost 13 years ago, I created a relationship with Princeton University. They had an Aura watch in those days that you could wear that would monitor all of your vitals. We were able to take those vitals and in a recovery episode at Carrier Clinic, follow those vitals as you went from potentially substance abuse or psychiatric issues, and then watch those vitals for the most part reduce in intensity. And so that we knew what it looked like when you were healthy and when you were forwardly psychotic or in an alcoholic mode. And so we would, once we released you after that recovery pattern, we were able to monitor you at home and then bring you in for what we called a checkup from the neck up whenever we thought you were coming off of those vitals. And that allowed us to have what we called an episode of care where we guaranteed care. If you had to come back in, it was on us. So it really made a difference on how we delivered treatment and the accountability we took for the success of that treatment.
And Howard, how does that impact your industry?
Oh, well, I mean, for me, it's, the Internet of Things enables the data connection to all different kinds of devices. And we can do a lot with that data to understand how a patient's actually doing in their home. But more so, it's about things like alerting devices. If someone falls, right, the technology automatically can get help for them, right? GPS enabled. We do things like pulse ox, right? That data goes right in, and then the nurse can look at it and make determinations. So I think the way that technology and the people in the home are working together really enables better outcomes and wellness for the people that we're entrusted to take care of.
Does that also help the challenge of readmission rates? For example, if there's a stat, if it's accurate, that 20% of hospitalizations are readmitted within 30 days. I'm sure it depends on a lot of factors, but does the technology that you're discussing now, does that assist with reducing those readmission rates and also the cost of care? Insurance has skyrocketed from the readmission and in certain cases the relapse rates of different things. Can you speak to that?
Yeah, I'll just say this, that technology 100% impacts those outcomes. When you have a person coupled with the things that we just talked about, that makes a tremendous difference in those readmission rates. And I see it even on the small scale in my office.
Yeah, the solution begs for technology in addiction. And addiction 1-year relapse rate post-treatment is in the 60s, 60%. What other treatment would you accept a 60% failure rate? Certainly not your orthopedics or your heart or any other part of the body. And so we need a full infusion, and I'll talk about some of those infusions of technology into addiction treatment.
Well, and let's talk about some of the advancements, because there's the in-home and the programming there also ties to what's done in a hospital setting and a procedural setting, right? And that's the part of the continuum of care. Let's talk about specifically this cutting-edge technology that is brand new to probably most of the folks that are here, that targets directly this 60% recidivism rate, for example, on substance use, with the ultrasound treatment, and also tie it into Parkinson's and Alzheimer's. Tell folks what's happening, this next big thing that's happening right now, Don.
So my job in any of my places I've worked is to find new ways of treating patients. And I have been recently working with the University of West Virginia's Rockefeller Neurosciences Center. Not necessarily a place a lot of people know about, but there's a doctor there named Ali Rezai. And by the way, if you want to see this in action, look up Ali Rezai, ALIREZAI, and 60 Minutes, and you'll see it in action. I went down to the University of West Virginia to watch this in action, so I was able to follow 3 different procedures, talk to the patients pre and post the procedure, and then talk to patients that have been through this procedure. Dr. Rezai has been at this for over a dozen years, looking at ways to impact neurons in the brain that are responsible for all 3 of those particular areas. And the newest one is addiction. And in addiction, in your brain, neurons start to fire in response to the substances. It's your genetic predisposition that identifies what neurons are going to fire. That's the connection to the history of addiction in your family. But once those neurons start firing, they begin to misfire, and they don't stop firing. Your brains, and you have a lot of control on it based on the chemicals that are in your brains, can impact that. Dr. Rezai has a surgery that has to go with a medication that lifts your blood-brain barrier. Blood-brain barrier protects your brain. It also ensures that the chemicals are balanced in your brain, and it helps to provide blood to your brain. So it's very important. If you touch it, you can damage it. And so he developed a procedure to lift it. That's the real miracle part of this whole process. Once he's lifted it, he maps the brain. He can identify the neurons that are malfunctioning. He uses ultrasound. You're literally in a bore getting this procedure, and he can disable those neurons. You are almost immediately, first procedure, no longer craving. It also has an impact, and he's working on Alzheimer's and on Parkinson's. I watched a woman who had Parkinson's who had a flailing arm. That's a normal kind of process in Parkinson's. And she was flailing her way into the bore. And when she's in the bore for 15 minutes having this procedure take place, no blood, no incisions, that arm goes from banging the top of the bore all the way to her side. She walks out not requiring any assistance without the flailing arm. One procedure. And that kind of activity taking place in those 3 areas, which have not had a lot of solutions and successful solutions, is pretty remarkable.
It's incredible. Howard, you want to?
Yeah, I can't top that. I can tell you, that's pretty amazing stuff. When you think about the practical applications, I mean, we in home care see patients that could be affected by this today, so I'm very excited about that.
Yeah, and go ahead, John.
Yeah, so we're talking, my business is going to be a franchise with health systems, and it really is in a kind of a middle design phase, and we will be looking at all the different technologies that are available for addiction around the country and testing them. This is obviously still in a testing phase, but it is now FDA approved, and it will be coming out to the market. Our job will be getting it packaged in a system that, by the way, doesn't eliminate all the treatment that you go through for addiction, so that we'll still be doing the social work, the addiction counselors, et cetera, but we'll be doing it with what we expect to be a much higher success rate. Once we eliminate the craving, a lot of the other things fall into place.
Is that new information for the folks here? Right? Raise your hand if that's new information. Okay. Yeah, round of applause. It's fascinating.
Watch 60 Minutes.
Yeah. So what you just heard, Parkinson's as an example. A patient, I'm just a layperson. Patient goes in. There's a procedure that the blood-brain barrier, as I understand it, it's tough on purpose because the body is not. So it's hard to get medications in because for a reason. That's right. Allows that the medications or the treatment to go where it needs to go, and these massive tremors for anyone who has family members or folks that you know that have Parkinson's cease.
They don't. It's not as fast as the addiction. It takes several treatments on it, but they cease at the end of that.
Right.
Yes.
So this is a multi-billion-dollar pharmaceutical business, right? That's threatened by this technology. I would say as a layperson, unless of course they're holistic in their minds and they want to be put out of business, right? For the treatment of Parkinson's, the treatment of other different things. And I think it was the amyloid plaques, was it, with the Alzheimer's, where they're going in and they have the scans and they map it, and then you see the scans where it's deep red, and how after the treatment, how it's the lighter color, so they can see that the ultrasound, that the treatment was successful, which I know that's more of a process. But you're hearing about treatments that are not baked into massive injections of chemicals and pharmaceuticals and these kinds of things that are really just kind of keeping you going. It's this curative side to it, which is, to me, so fascinating. And the multi-billion-dollar addiction recovery business, right, where it's repeated business by a certain percentage that are always coming back. It's incredible.
It has the opportunity to be a profound difference for a lot of people, though. That makes that equation worth it, because if we can eliminate the craving process, we've eliminated probably what we expect is 60 to 70% of the potential for relapse, it then makes addiction treatment successful. And it gives a shot for family counseling and all the other things that are necessary. If you look at the single most important thing in a recovery episode, it's being able to detox a patient and have it last, to get the substance out of their system. And then, by the way, to get the craving process out of that equation makes a world of difference.
And bringing it back to the continuum of care, the facility, that incredible technology is, that treatment protocol is in place, and then they go home. And then where does that pick up from home helpers and the different folks that are part of that integrated community of continuing the care and using technology and that one-on-one contact? Like how would that integrate with the post-procedure care to ensure proper recovery, ensure best health?
Yeah, well, I think with most kind of traditional procedures, surgeries, stroke, heart attack, things like that, home care is an integral part of that. It sounds like with the technology that you have here, the person walks out and they go about their daily lives. That's an amazing thing. But in terms of the services that traditional home care services, when that person has that traumatic event, that traumatic surgery, long-term hospital stay, they need to come home with a significant amount of help. The best place for them to be is in their home, safe, okay, with another human being that's designed to take care of them. That coupled with appropriate, PT, OT, and additional support, the basics, wellness, nutrition, hydration. We want to make sure that all of those things are provided in the home so that that person can have that best outcome. And then we think about the readmission risk that we have since reduced, right? Anytime that person goes back to the hospital, that's when there's not only the expense of that hospitalization, but that person could have had another traumatic event. That's I think the best of what home care can do.
Yeah, in our case, we will be taking care of the medical issues, but in addiction, social determinants of health have a enormous responsibility for how you react to drugs and alcohol. And so a job, a happy family, a stable home, all of those things are important aspects of your disease. Addiction is one of the few diseases that takes those away. And so what we need to do is go back in without your craving the drug, with a great opportunity for you to recover and to help you then repair all of those broken pieces. And so we think that we'll be much more successful helping you with social determinant issues if we've got your brain clear and you're able to not emotionally think all the time about where you're going to get your next fix. And you're not afraid of the fact that you're going to relapse. Imagine being able to get treatment and feel good, but the moment you go back to your environment, you're in an environment that's highly tempting, that's highly stressful, whatever led to your original addiction, to have that at your fingertips in a much more healthy and thoughtful way to address.
It's well said. Thank you. You know, Howard, you have been a community maker and working with nonprofits in Monmouth County and getting so many great things done for veterans. You know, this month is also Alzheimer's Awareness Month. How does that tie in? What you're hearing about this technology, there's the substance use treatment, the Parkinson protocols that are being rolled out, and I believe things are in trial stages and what have you, as far as the Alzheimer's space. How do you see this reimagining the in-home care side for those very important organizations that you support, the veterans group and some folks that can benefit from some of the advanced care and Alzheimer's and how it relates to in-home care?
Well, I mean, at the end of the day, if we can get non-invasive positive outcomes, I think that's a huge leap forward. What we really try to do is provide quality care, and technology is a tool to be able to do that, but obviously we can't do that without the people. I think the people in compassionate care are what matters most. And you know, when I look at partners in care, you know, because we talk about the continuum of care, those partners matter tremendously. And you know, I think you know, being in a chamber meeting like this, when I look around the room, I know these community partners. We work together. We break bread at the table together. We're able to talk to each other competently and confidently about our patients, our shared patients, and that's, I think, what enables some of the best outcomes. When we can partner with other quality providers in a common care plan, care solution, that's when we have tremendous results, and those patients are the beneficiaries of that. And it doesn't matter if, you know, they're a veteran or otherwise, but all of these tools in the right hands with the right people actually make a difference. And you know, that's the best part of my job. When I see someone who was in a serious crisis come out of that crisis and can have a better quality of life, that's what this is all about.
Yeah, we're on the same pathway, which is a great pathway to be on. Hospitals are vexed by addiction. And for any of you who have taken a loved one into an emergency room, it is the toughest patient for an emergency room to handle, because it's not only the disease, it's all the behavior that accompanies it. And when you're detoxing, which almost automatically happens when you enter an emergency room, you are then faced with the consequences of a very, very difficult time period that you're in, and you're in a hospital. And hospitals want to get you out of there as quickly as they possibly can. And I had 16 hospitals at Hackensack Meridian I was responsible for the behavioral health in. And I can't tell you, my phone rang all day from hospitals saying, "Can you get so-and-so a bed?" And we were talking before this about the fact there's a scarcity of beds, basically because of the repetition of patients going over and over and over again into those beds. And so this treatment offers an opportunity to not have that cycle be repeated over and over again for a patient and for the healthcare systems. So everybody's interested in this. I can't tell you how many interruptions that we had when I was working with Dr. Rezai down in West Virginia, because every hospital in America's interested in it. And my job and my partner and I's business is going to be, we hope, taking those services to other health systems, teaching them, enabling their surgeons to do the work, and changing the way that experience starts and absolutely changing it the way it ends.
And both of you are in the franchise model. What made you choose the franchise model to scale this moving forward?
There are not a lot of franchises in healthcare. Hospitals like to be able to control, and rightfully so, all of the design, who runs it, the quality, all of those things are the responsibility of a hospital. And if you cede it over to a franchise, you lose some of that control. Our job, and particularly my job, is being able to create a service that is Joint Commission approved. That's the gold standard, that it meets each hospital's regulations. So it'll be unique in many, many different areas depending on what the policy and procedures are in those, from Kentucky to I've been out working in Oklahoma, which has one of the highest addiction rates in the country. And by the way, we are looking at how to use opioid settlement money effectively for treatment, which a lot of states are vexed by. And so West Virginia's in the same shape, very high degree of addiction, and they're in the Mecca now with the Neurosciences Center built by the Rockefellers to be able to pull this off. So we think that this is going to have multiple ripples in the system, where the money goes, what it goes to, how hospitals redesign the way they do their work, and that we can have a revolutionary impact on it.
Thank you. And what he's alluding to, there's massive multi-billion-dollar settlements, opioid settlements from these really peddlers of death in certain ways for folks that are getting hooked. And it may be something from like a shoulder surgery or something else, and they've really clamped down on it. But municipalities across the state that I'm familiar with, that have gotten hundreds of thousands, millions of dollars that many of them don't know what to do with. And so they may deploy it within their own communities if they have programs that are needed and necessary. There are many communities that aren't quite sure how to deploy it and are then, which is a good thing, they're sending it to their counties, because their counties have robust health systems and robust health departments. So that's one of the ways that they can deploy these resources. So what's interesting about that is because it's a solution meeting the problem and the solution coming together, where resources are there for reasons that no one would ask for from settlements, but being able to deploy them and having being able to scale that for local communities. And, I think it's worth talking about briefly for a moment. We're talking about substance use and talking about a number of different things today, but can you speak to, Don, this was your life career in helping people, and it's a different ball game. 97% of heroin is laced with fentanyl. The marijuana, the 60s or 70s or whatever, it's not this high potency product where children are hallucinating and being or poisoned, where it's not even an overdose. One pill delivered Snapchat under a doorstep when your parents are watching Netflix, and you can be killed. So can you speak to that, and how does this, it's almost like you have these two freight trains. You have this freight train of merchants of death, the dealers, with highly concentrated lethal doses of fentanyl, heroin, with children who are maybe experimenting. They're not thinking. They're not mature. With this freight train of treatment, how is that? What's that crash going to look like? Is it? You follow?
Yeah, drug dealers are dealing with this as an economic issue. I mean, they don't want to lose their clients. And if you die, you're less sales for them. So there's a mutual interest for all of us to be able to get fentanyl, especially because it's the most lethal part of any drug mixture, out off the market. So I think that that's going to be a governmental solution and a law enforcement solution. It will be interesting to see what happens with the next presidential cabinet and how they attack the issues, because it's a multi-cabinet issue. Our job is to make sure that we decrease the demand so it's not as lucrative to be in our markets. And in every state, there are multiple markets that are lucrative and that drug dealers gravitate toward. So this is a societal issue. We won't be the only solution to that issue, but we will be an important part of it because we will decrease demand. Now we know that we may not be able to operate fast enough to do that. That's going to take a massive amount of change in the medical system to accommodate a new surgery of this nature. It's almost like surgery centers when they opened up 25 years ago. It was a very slow buildup in the availability of surgery centers. But look at it today, it's ubiquitous. So it's a long journey. Our organization will be built for that, and we think that we can have an impact on both the health system and obviously the general population.
Thank you. Tower, do you want to speak to that?
Well, I mean, I could talk a little bit about the entrepreneurial side of franchising. For me, why did I choose a franchise? Because I wanted the platform. Okay, I wanted the existing platform so I could focus on the culture of my organization, so I can focus on the relationships that I needed in order to service my clientele. If I had to reinvent a platform and build all these things, I couldn't really focus on the business that I wanted to, which was taking care of my patients. And the franchising model has not only given me that opportunity, but it's allowed me to continue to scale my business in a way that's material and meaningful. It enables my staff to grow along with me, and I'm able to employ more people in our community, which is one of the major goals that I set out to when I started my business. So, you know, franchising, I think, has its pros and cons, but for me, it's been an amazing opportunity. The reason why I chose Home Helpers was because of the people at Home Helpers. The platform was secondary because I chose my partners based on the people and the personalities that I wanted to work with.
Well, and go ahead, John.
Yeah. Our idea of going with a franchise was about being able to take the goodwill of good hospitals around the country. So our initial efforts are with university hospitals. Our business is actually called Addiction Recovery Science and Services. Science first. And it's getting the science right. And university hospitals are the source of most of the science that you see happening in healthcare. So we've got the goodwill and we have the good skills of hospitals around the country that we'll be partnering with. And we operated under their umbrella. So we expect that it'll be accepted more quickly and more effectively using that kind of model.
Thank you for that. Howard, you built a fantastic team. So I'd like to get into team building, and also we're going to open up for questions in about 10 minutes, so get them ready. I'm sure you have some fantastic ones. And then we're going to close up and talk about the next big thing and what's next in your industry. I think we're hearing about it as we talk. But you built a fantastic team. What is the challenge on attracting and retaining key employees, and your thought process on team building as well? And I'd like to hear from Donna as well on that from your perspective. Let's start with you, Howard.
So I think one of the biggest challenges that we face in healthcare today is the shrinking workforce. It's been really challenging coming out of COVID. We know that particularly in in-home care, we lost 17,000 HHAs in the state of New Jersey, okay?
What's that acronym? 70,000?
Home health aides, sorry.
Home health aides.
Home health aides in the state of New Jersey post-COVID. Okay, when you have a significantly growing population, a significantly growing demand, how do you service those people when you have less people to do that? So we came up with a game plan, an approach to attack to attract, retain, and actually create more certified home health aides. And I think, it starts with a culture of caring in your organization. And that's something that's always been very important to me, both in my corporate career and now as a business owner, is actually being able to tell people that you care about them. And how do we do that? We show them that through how we pay them, the dignity in which we treat them with, right? The ability to collaborate with them, to communicate to them, to actually hear what they're saying, their needs. What do they need to be successful? And then working with them to provide that as best as you can as an organization. And I think if you do that with your own organization's leaders, and they then do that with the team that they manage, I think that's where the culture really comes to life, and then you're enabled to deliver on the promise that you set out to do. And I think that's been really one of the secrets to our success, because at the end of the day, how I judge the business that we do is by the quality of care and the outcomes. And the only way that we can have that happen is if we have a stable caregiver in the home that is actually able to do the job. And that's not an easy thing to do. The training, right, the ability to stay with that client really matters. And I think that that all stems from a healthy culture.
So I agree, culture is king. And if you're a drug and alcohol counselor, imagine you having a 40% success rate, maybe even 30, depending on the type of addicts that you're dealing with. And having that be your experience every day, you're going to burn out pretty quickly. So we believe that we will be able to attract the best and the brightest to work with us. One, because it's a hospital behind it. They're well paid, well benefited, and well treated. Hospitals know that culture's important. And secondly, the fact that we will have a successful way of treating patients. So you're going to be seeing more and more people actually go into the business who are recovering, because we expect that our recovery rate will be so much better. So the combination of those, we think, will be a way for us to handle the shortage of counselors in the addiction field.
Thank you very much for that. We're going to actually move on to some questions from the folks that are here today. You've heard quite a bit so far, and a wide swath of healthcare initiatives and news that you can use for yourself and your family. Well, thank you. We'll start right with you.
Hi, thank you guys. That was a great presentation, and I think incredibly valuable. I don't have any experience on the addiction side, thankfully, but I do unfortunately have a lot of hard-earned experience on the home health side. I actually feel like this is probably a business that's poised for explosion in the coming years, given the aging demographics. However, I think there's some key barriers, and I'd be curious about your feedback on this. For one thing, I learned all of this the hard way. I set up home health care 4 years ago for my mom, but I was strongly discouraged from doing that. The hospitals and the step-down facilities kept pushing nursing homes on me and hospice and all of this. But fortunately, I came across someone who said, recovery at home is the best option, and that's what I did. But it was painful because, I had to seek out all the partners of care. I had to buy all the medical equipment. So the two barriers that I saw were, one, highly fragmented industry. I think there needs to be some kind of navigation point that's helping patients navigate all of the components around this. And if you get that, you can have very successful outcome. The other barrier I saw was reimbursement. So I don't know if you guys have a point of view on that. And the other thing I couldn't tell is if the home health care you were referring to was acute or chronic. Because I think acute, the rehospitalization issue, is critical, but chronic home health has a very different kind of need. And I think that the HR or the recruiting issues you were talking about are real. So I applaud you guys because I think this is critical.
Thank you for that. You want to comment on questions? Or?
Yeah, I mean, I think how people are given information, unfortunately, has to do with where it's coming from, right? So if you're in an institution they are trying to keep you institutionalized, right? To take all those benefits to continue their business. From a person who runs an in-home care business, I think case management, care management, a holistic approach obviously is the best approach, but you got to find those resources that are aligned to what the patient's wishes are, right? And if someone wants to remain in their home, right, safe at home, you have to be aligned to a agency, a facility that has that in mind. And I think that is a challenge. I think navigating the healthcare system today is a disaster. I think our whole healthcare system is really not set up for patient success. It's set up to capture, medical expense, not to enable wellness. And I think that is something that until that changes, right, I think, health insurance is a barrier to that. But if you find the right resources, if you find compassionate outlets that align to the patient's goals, in a community like this, it is achievable. And I think that, the results that we get from that actually speak to themselves. And the nice thing, though, is that then the medical cost savings actually happens because these people don't get into a situation where they have a traumatic event, have a fall, right? Because the right care is provided at the right time. So, I think the healthcare industry as a whole needs a lot of work. But if you find the right people and the right resources, it is achievable.
Yeah, I selected a partner and he selected me. We have complementary capabilities, mine in the treatment world. His was actually founding and running a business called Medically Home. And he took highly compromised patients who would likely have spent multiple months in hospitals and or nursing homes and brought them home and used technology to do that. He started it 10 years ago. By the time he finished, he had 180 hospitals. 80 of them were in the top 100 hospitals in the country. And we met at a conference. I was speaking, it was the last speech I gave as a fully employed person. I was speaking to a group about the future of behavioral health. He was speaking about the future of home care. We were back to back. He heard me as I'm walking up to the stage. He said, "Parker, we need to talk." We met at a bar, ironically, that night. And 6 hours later, we had a deal penned out on several napkins that we both signed, and we've been working together since. Luck made that happen. And I have recently been doing lectures on luck in your career. And my own personal theory is the harder you work, the luckier you get. But the luckier you get, the harder you have to work.
That's very well said. Now, if anybody asks, it was Barbella where they met, right? And we have the napkins over here, the next to the Nobel Prize. No, it's cutting edge, great stuff. Okay, next. How are you, sir? Welcome.
Yes, I want you to introduce yourself first, too.
All right. Hello, everyone. My name is Mike Cevolino. I'm Executive Director of SCAN, the Senior Citizens Activities Network. Thank you for this wonderful presentation this morning, gentlemen. Question for Howard. Howard, I would imagine two of the biggest stumbling blocks or issues for home care agencies like yourselves is, one, the stability in the workforce, that a testament to the way you run your business is a point of differentiation for you, and then also overall differentiating yourself from other home care agencies. So my question to you is, do you leverage your stability in your workforce as one of your talking points, and how else do you differentiate your business from all the other home care agencies out there? And thank you, guys.
Thanks, Mike. And, I think the easy answer to this question, Mike, is working with great partners like you and SCAN, right? That is a differentiator, right? When you are a participant in the community, as a community provider, magical things can happen. For employees and the stability of employees, I'm going to stick with culture. I think at the end of the day, people work because they have to pay their bills. So for me, one of the things that was always important was to be able to pay them what they're worth. And I think that that is something that we continue to work on and we continue to move forward on. But, the way the care continuum in the community is the most important thing. It helps us amplify our message. When I have folks that understand what I do and how I deliver service, that is more powerful than anything that I can do on my own. That level of organic messaging that gets amplified by other providers is the best source of information for those recipients of it. So, I appreciate you, partners like Brightview, I know they're out there as well. That's what makes a huge difference in my approach and the way I run my business. So thanks for that question, Mike. Really appreciate it.
Thank you. So for the future franchisers of America, from Homedale High School, welcome. We're going to hear some great questions right now. Hi, how are you?
Hi, I was just wondering how you would plan on marketing this and showing. I think it's important to show young people this is a serious issue, and how you plan on getting that information out for us as a new generation. It is important that we should know this and to help people. And how would you plan on
If you're in front of every high school in America right now with the seniors and rising juniors and all the folks there, what do you want them to know?
I think your generation, more than any of the generations I'm dealing with, now being in my 70s, I've got a lot of generations behind me, is more...
And he's just getting started.
That's right. We just started on a new business. I think that you're more interested in science than any other generation. I have 9 grandsons, and they all are focused on science as a way to solve problems. We didn't do that. Obviously, you come up with a business that has a 70% failure rate. We didn't do it. So I think that we will have the opportunity to advertise and use technology to get to you more quickly. And from our point of view, we're going to start working out of the emergency rooms. I don't think we're going to need much advertising to get clients that way. Ultimately, we want to be able to take, and that's why our business is called Science in the name, is take it to you on a proactive basis ahead of your game. And so I think that face-to-face, through the internet, through all the different means that you pay attention to.
I actually think that that's a really important question for any business owner, right? How am I going to communicate to a specific demographic that's important to the future of that business? And that's something that as a business owner and as an entrepreneur that I think about all the time, right? If I am trying to get to a Generation X individual, maybe I'm using Facebook. If I'm trying to get to a younger demographic, maybe I'm using a different tool like a Snapchat or something, like that. Those, the way that we communicate to different generations, different demographics, different types of people from different economic backgrounds, all of those things we have to consider when we're crafting our message and thinking about who the intended audience is. So from a marketing perspective, from a communication perspective, those tools and how we do it are super important, and it's something that I think about all the time.
Thank you both, and thanks, Terrence, again. In terms of the scaling of a franchise, that might be complicated. You touched on it briefly. What are the kind of the plans both of you have in place to keep procedures in place, SOPs in place, and the millions of people who could be affected positively by some of the changes you're talking about in the structures of the brain? And I mean, it's really fascinating. maybe you can touch a little bit more about how many people could be touched in communities and changed and transformed on both sides, and how does a franchise model work with that in terms of insurance coverage? It's a fascinating business model on both sides. I'm just curious to know more about it.
Yeah, I think any franchise, whether you're McDonald's or a health and fitness facility that are franchised, would be very, very excited about getting in a market that we're getting into. You got 20% of America are addicted today to something. And that's a low estimate, and that's a limited number of addictions. So we have addictive personalities based on the lifestyle we live and where we live and how we live. And so we don't think we're going to have any trouble having a very solid patient base in the businesses that we're in. Ours is going to be able to get the right people to deliver the service and to deliver it with the quality that we expect. We are going for the best and the brightest university hospitals across the country as our first cohort of customers. And we expect that the science in each of those hospitals will be the governance of our organization. We do have different ways of looking at things based on the hospital that you go to or the doctors groups that you go to. However, there are some basic theses in that. And that we will identify and use those as the foundations for the businesses that we're in. And then we will customize and make individualized plans available based on the markets that we're in. So it's going to be it'll be like working with the blood-brain barrier. Nobody thought they could ever penetrate the blood-brain barrier until Dr. Razai figured out this little substance that looks like scrubbing bubbles. And it gently lifts it up just enough so that you can actually penetrate it with an ultrasound and with medication. So that little change was important in all of this. Somebody found it. We're going to keep science at the forefront in what we do because we think we can continue to find those kinds of innovations.
It's so interesting to me. A comment I wanted to make, because Howard, I know how passionate you are about our veterans. And I work a lot with the veterans, and I've written a lot of articles about PTSD. There's also a lot of unfortunately, substance use disorders with veterans tied into, the suicide rates and the PTSD and the different mental health issues. But I could see so much positive coming out of this different treatment that you're talking about, Dawn, and the passion that you have, Howard, for helping these veterans. I mean, the suicide rates are through the roof. I think it's 21 a day. Am I right? Yeah. Remembering? Yeah. I think there's so many different, if you can penetrate the brain for addiction issues, I think you can you could help with depression, PTSD. I mean, these are veterans who fought for us, they're major combat, and they come back and they have crippling PTSD where they can't function in daily life. But I just see some interesting things.
Yeah, I have a personal interest in this. My son spent 3 tours of duty in Iraq as a Marine. He passed away last Thanksgiving, the day after. And he passed away because he ran burn pits. And burn pits are driving a truck in, you're not bringing it back to the United States and lighting it on fire. And his supervision of those led to cancer. Ultimately, the cancer led to addiction. It was so virulent for him. And he essentially committed a very slow suicide in this. So you can bet, I can tell you we are already talking to hospitals that specialize in handling vets. We will be talking with the VA. And they are already interested. So we will be very involved with soldiers. My father, I was a Navy brat. That got me into social work because I was helping other Navy brats how to figure out how to handle. I went to 11 schools in 12 years, how to handle that constant change in the soldier's family. And their family are an important part of their support system in keeping them healthy. So I'm wound up in it, and I will stay very involved with the military.
Thank you, and my heart goes out to you. I believe there's no more difficult journey than that of a bereaved parent.
Don, your son's name?
Matt.
Matt. Well, we're honoring Matt's legacy of service to our country today, and that is a very powerful testament to what we were going to have in concluding comments in a moment about what your why is, and I see that so poignantly just by that very, very compelling message that you just shared with all of us. Therese?
I want to thank both of you for everything that you're doing. My question to you is, when you look at where you are today versus where you were when you started your path in life, looking for the career that you would be this passionate about, I guess, and for our students over there, what advice would you give yourself, where you are today, to your past self? What advice would you give to find, maybe to help? I know experience gets you there, but maybe to help with a more direct path to get here, so you can get this work done maybe sooner, or you know what I'm saying? Just what advice would you give to yourself starting in your careers versus today?
I had this unusual passion a long time ago. As I mentioned, being a Navy brat and helping other kids. And when I told my father I was going to be a social worker, he said, "That's not a career, son." He said, "That's for women." And so, well, remember, this was back in the 60s that this happened. And by the way, I happen to be the only graduating male in my social work master's degree at Rutgers in 1974. And you know, I'm extremely passionate about being a social worker, and I think that I got a job running a detention center in 1972 when I was 21 years old, and it was luck, and it was, by the way, down in Atlantic County, and I was working in Mattawan with gangs in Asbury Park. There were gangs back then, and my job was to keep the gangs from killing each other. And so I got a very bird's eye view of delinquency at its best. And I took it with me at 21 years old. I had to borrow my dad's suit. I didn't own a suit. My dad relinquished his suit, and he's only 5'8". And so at that point in time, I was a little taller than him probably today. And the sleeves were up to here. I had to sit like this as I'm doing my interview and pull my chair in to make sure that the guy didn't see how bad my suit fit me. And by the way, I asked him a year later why he hired me with not a lot of experience to run a detention center with 60 kids in it. And he said, "You were the most intense interview I've ever done." He said, "You pulled your chair up right in front of my desk and looked me in the eye and answered all my questions by leaning in. Little did he know I was hiding my suit." And so I think if you're passionate, it starts early. And if you find that passion as early as I did, it can just keep continuing to grow. And I'm 73 now. It's still growing. So,
I would say if you love what you do, you'll never work a day in your life.
Amen.
And that, you know, has kind of been what's fueled me. But, you know, I think another key to success is, you know, obviously you need to work hard, but I think there needs to be a willingness to do the job that other people are not willing to do. And if you do that consistently throughout your career, you'll find that people will appreciate that, and that will be the catalyst for other opportunities. So, you know, if you really love what you do, that's the fuel, that's the passion, that's really going to be the catalyst in your career.
I'd like to have a shout out for Genesis Orthopedic and Spine. Thank you so much for being our sponsor today.
Thank you.
And Don Parker, Howard Stein, I really, you left us in such a beautiful space, and the legacy of love for Matt and the work that you're doing. And, you know, we're all on this life journey, right? And I sometimes talk about the ripples in the pond. You don't know where they all leave. Even from the chamber meetings that we've had, the video podcast, we've hit some very serious topics. Yeah. And lives have been saved from these meetings, from the information that's taken, and it follows and it follows. And you may not know where or whom it may be, and that isn't even the point. The point is the tools and information and wherewithal, is it going to hit its mark and save a life, help a family, and help us all do better as human beings? Jeannie, was there another? One more? You want to bring us home, Therese?
I would love to bring us home.
Okay, thank you.
Just so everyone out here knows, if you like the content of Chambercast every month, we do hit the hard topics, the topics that are maybe taboo to talk about, the topics that are tough to discuss but need to be discussed, and we educate and inspire. And I have to say, as I always do, the walls bring these topics to us. Jeannie works so hard to bring us this kind of content, and I just want to give it up to Jeannie and to Terrence for the work that they do to make this one of my favorite events every month. I love Chambercast, so thank you so much.
Thanks, Therese, and thanks for all the work you do. And Monmouth Regional Chamber of Commerce is a must to join if you're a business. So there's how many events a month? About 10 events?
Yeah, we average between 8 and 12 events a month, so 10.
Yeah, so it's an immediate way to get networked into the community and the business community, the nonprofit community. So thank you for all that you do.
Thanks. And before we go, I'd like to, Howard and also Don, if you can share how folks can stay in touch or to follow, or website, or other ways that they can follow the work that you're doing and share that work. Start with you, Howard, with your organization.
Sure. www.homehelpershomecare.com. You can find me on YouTube, Facebook, Instagram. I'm always communicating about topics that are important to me within healthcare, education, and I would say, the advocacy piece, which I think Jeannie was kind of alluding to in her question, is so important to me. If, for things like Veterans Affairs, go to Trenton, go to Washington. If you have that passion for those changes that need to happen in society, it's up to each individual to do the work to make that change. And, it can happen. And I'll use the example of the Elizabeth Dole Act that just got passed in Congress because of advocacy work that's now going to enable veterans to get 100% of their benefit for in-home services. So that's very relevant to what we're doing, right? But that only happens if people that are in this room go and do that important advocacy work. So that's the driving force behind change.
Thank you. And Don, would you also share how folks can follow your work, and what message would you like to leave us with today?
Sure. We're not as developed as Howard is yet, but our name is called Addiction Recovery Sciences and Services. It'll be a lot catchier because we're in the midst of putting a new name on it. So, but you can look us up on that. I would ask you to read a book called The Infinite Game. It's by Simon Sinek, and it is a spectacular book to take a look at the longitudinal impact that you can have in life. And the chances that I've had to have what I call seminal moments in my career and in my profession have been unlimited by taking that perspective. So I've had multiple careers in healthcare. I've run multiple things. I've started multiple things. I've been an entrepreneur all my life, and I've been able to do things that I never imagined. And I read Sinek's book earlier this year. I've read several of his books, Leaders Eat First or Eat Last, things like that. But The Infinite Game, is a great perspective for you to have, especially if you're young.
And there they go, not paying attention to this important. We're giving you a very, very. We need a book on attention.
There it is.
Infinite Game.
Infinite Game.
Game.
Infinite Game, and it's Simon Sinek, Sinek.
And how can folks follow your work?
So look up that. We do have a website, but we're not putting out much right now because we're really designing, and we want to make sure our design is infinitely successful. So we're early game. You can look on 60 Minutes. You'll find us again probably coming up on 60 Minutes. If you do see the Rockefeller Neurosciences Center, we'll be in on that. So.
I'll post the 60 Minutes video on the homepage, on the page for Chambercast. Okay.
Great. And for me, as you can tell by my suit, I'm going to be getting ready for my interview with Don Parker. So if you see me in a short suit, I'm going to be tucked up nice.
That's it.
All right. Well, it's an
I go like this still. I'm used to that.
It's an absolute honor to be with both of you today, Howard and Don. Thank you so much. Huge round of applause for our guests, folks.
We're going to take a group picture.
Have an excellent Thanksgiving, a bountiful Thanksgiving, and have a family Thanksgiving.
Thank you.
Amen. Well said.
And
Folks, we're going to have a quick group picture up here. Stay in touch. We'll see you next month. And thank you to everyone for being here and the folks that are watching with streaming online. Please share this content that you heard today, and we hope it provided benefit to you, your families, and your businesses. Thank you very much. And thanks again, Genesis Orthopedic and Spine. All right. Thank you very much, folks. Come on up for a quick group picture if you might, and we appreciate your time today.